It's a pleasure. And before I start, I'd like to acknowledge that this presentation is taking place on traditional First Nations lands. And it's a beautiful day outside here in the UBC campus. A little chilly, but very nice. So what I'm talking about today is the common indoor radon levels that occur out across Canada. We've found some in British Columbia, and the new International Commission on Radiological Protection, alpha radiation to the lung tissue effective dose coefficient. In other words, in 2017, the ICRP, the International Commission on Radiological Protection, essentially doubled the risk associated with radon decay products hitting lung tissue. So there's radon gas. I'm going to go through some basics. A presentation on radon needs to cover some of the basics. I was to my doctor last fall, and she says, "Well, what do you do?" And I work at the health department. I'm an environmental health officer, and I'm involved in radon. That's one of the things I do. She says, "What's radon?" I thought, wow, okay. Then I explained to her, it comes out of the ground, it's an indoor air contaminant, and it causes lung cancer. And she goes, "Oh, wow." She says, "There's a lot of lung cancer in Kelowna." So, yeah, I'm going to cover some of the basics. Indoor environments, especially workplaces, can vary considerably. There's a new building in downtown Kelowna, 5-story, or an old style house built in the 50s that could be a daycare, for example. So the building envelopes can vary considerably. So what is radon? It's a gas. It's invisible, odorless, tasteless, radioactive gas. And it occurs from the decay of uranium to radium and radon. It's global. It emits radiation. It's considered ionizing radiation. It's chemically inert, heavier than air. And the big issue is when it decays, it produces an alpha particle, which is called a radon decay product. And radon decay products are listed as group 1 carcinogen. And in the epi field, folks that study radon consider it the #1 environmental carcinogen. It's way ahead of particulate matter, arsenic, and the others. So a little bit about the International Commission on Radiological Protection. It's the primary ionizing radiation protection body. It's created in 1928, so it's been around like for 90 years, way before World War II. It's a non-governmental, and it consists of an independent international network of specialists. They produce about 4 publications a year, and at any one time there's a couple hundred scientists and policymakers actively involved in ICRP work. So what I'm talking about today is the new publication 137, and it's basically a succession to many previous publications, and I've indicated a few there, but essentially the effective dose coefficient that been running on for years, and I might say a lot of industries are still using the old dose coefficient, because this ICRP publication 137, although it's dated 2017, it was only released in January 2018. So it covers off the effective dose coefficient for radon exposures to lung tissue, and the critical aspect is that it's doubled from what it was previously back since 1990, and I think the document was released 93. So it's a lengthy document. I encourage folks to read the 6-page summary. It's a really good, easy read. Now, one of the things we contend with in the radon world, so to speak, and trying to promote people to test and mitigate, is people will often say, well, radon is natural. Well, what isn't natural is the way we build. And we build tighter and tighter buildings, more energy efficient, There's a goal for 2032 for a net zero energy, they call it, tighter and tighter buildings. So this is a concern when we get into tighter buildings, and radon, as I say, is an indoor environment issue. So how does radon get into a house? Well, it gets in by the stack effect. I'm going to use my mouse here to put a little arrow on this diagram. So radon can come up through dry drain traps. People should always keep water in their drain traps, and it's a good idea. You can pour a little bit of vegetable oil in. It stops evaporation. There's what's called a cold joint here between the two seams of concrete. It can come in through different little seams. Actually, it can come through even cracks in concrete, sump pumps, things like that. And it can come up, if you have a well, it can come up into the water and out the shower. And essentially, the time you're going to have the highest radon in the house, generally speaking, is in the cold months of the year, because we heat buildings, hot air rises, and to replace the hot air, you have air coming in from the ground and up into the building. If you were to take a radon detector and put it underneath a slab, you're going to get huge amounts of radon. It only takes a small combined area of about the end of like a Bic pen, or a centimeter diameter or so, for radon to get into a house that can be higher than some of the guidelines that I'll get to in a few minutes here. And here they are coming up. Just to cover off some units, we deal with, in Canada, we use the International System units, which is becquerels. The United States uses picocuries per liter. We use becquerels per meter cubed, which is 1 disintegration per second per meter cubed. And when there's a disintegration, you get an alpha particle released, and that produces what's called a radon decay product. Previously, they were known as radon daughters, and then they were called radon progeny, which they still often are, but most times now I hear them called RDPs, radon decay products. The commonly used conversion for air is 1 picocurie per liter equals 37 becquerels per meter cubed. So we have different guidelines, reference levels, action levels, and this sort of thing. The Canadian guideline is 200 becquerels per meter cubed. Converted in USA terms is 5.4 picocuries per liter. USA EPA action level is 4 picocuries per liter, or 148 becquerels per meter cubed. In other words, the USA action level is more protective than the Canadian guideline. And there's the World Health Organization 100 becquerel per meter cubed recommendation to nations to establish that as a reference level. Now, if you read documents produced by these organizations, you're going to find them promoting the as low as reasonably achievable approach. Less radon, the better, you will read. So typically, Canadians spend 90% of the time indoors. We get comfortable in our homes. You can't see, taste, or smell radon, yet radon can be lurking within. The highest house I know of that was tested is in the Kootenays. Now remember what the Canadian guideline is. It's 200 becquerels per meter cubed. This basement in this house was tested at 37,000 becquerels per meter cubed. The main floor was 7,800. And interestingly, this was a previous workplace. The basement was actually a grow-op, and there were people working down in this. Now, Paul Muntuck from Interior Radiation Protection Services have been mitigating places in the Kootenays for years. He got this house, the basement down to 29 and the main floor to 22. Excellent job on that one. The annual radiation exposure, there's a pie chart, and back in the 87 era, radon consumed a lot more of that pie chart than it does today, or I should say in 2009. But where it exactly is today, I'm not quite sure. But this medical radiation exposure that's going on, I hear people getting gift certificates for presence to go and have a body scan or something, and this is consuming more of the pie. But radon is a major source of our natural radiation dose. CareX says lung cancer is a leading cause of cancer death in Canada, and cancer is a leading cause of death in Canada, according to Stats Canada. So this is a map. I just want to kind of put to rest any thought that, oh, we don't need to worry about radon. I can tell you we're sitting in this room here today and we are breathing radon. I have no idea how high it is, but it's here. It's global, okay? And you'll see this map, the red area on this map means a higher, more prone area. You're less likely to find it on the coast here in the Lower Mainland, but there's certainly been high levels detected. Radon can also come out of building materials, so it can be hauled from gravel that's obtained somewhere else and mixed into concrete. Essentially, Health Canada recommends anybody in Canada, coast to coast, should test. The BC CDC did a tectonic belt map, and the 3 belts from the east to the west are more prone than the ones on the coast and the island. But again, there's still been high levels found on the island and high levels found in the Lower Mainland. Whatever you do, don't use maps as a reason to not test. Maps is a really, use maps for information, but everybody should be testing. There's a Canadian map produced by a company here in the Lower Mainland, Radon Environmental. If you Google them, there's a beautiful nationwide map of different uranium deposits and the relationship it could potentially have to higher radon. Don't let somebody tell you that just because there's no rock or you're in clay that you don't need to worry about radon. It's there. I live in a clay belt in Kelowna. Clay's so tough I can hardly dig through it, and I have high radon in my house. So the second leading cause of lung cancer, Health Canada, World Health Organization, EPA, it's second to smoking, and it's also indicated as the first leading cause of lung cancer for non-smokers. So it's now these numbers here, the 8 to 15, like that's quite a spread. One of the difficulties with all of this associated with radon is a long-term chronic exposure disease agent, and there's lots of studies being done. There's lots of extrapolation to miners in the mining industry, but to do a really decent full lifetime study, you're going to need a master's or PhD student to set aside 70 years of their life to follow people through their life and their different exposures, and that's not likely to happen. So there's lots more to learn on this, and any students looking for a project to do, I can tell you there's just a huge amount of opportunities and possibilities to do a thesis on something associated with radon. So Health Canada, 3,200, I heard the other day, lung cancer deaths a year in Canada. When you read data and material and reports on lung cancers, be really careful to tweak out whether they're talking, or any cancers, whether they're talking deaths or cases. Now, lung cancer has one of the shorter lifetime expectancies of 5 years, roughly, if it's not caught early, especially. So, again, radon's like other radiation, other exposure agents. Risk increases with the increased length of time exposed and the increased concentration. Now, important here is that the linear non-threshold model is what is being used by most scientists out there when they examine radon and what its potential effect. In other words, that assumes the ALARA model where no exposure is safe, basically. Any exposure is going to cause an effect. Now, there are thoughts out there that there's what's called a hormonous, sorry for the spelling and the interpretation, but it's a effect that sort of works on a J curve, where if you have absolutely no exposure, your body doesn't get used to it, and you can actually, when you're exposed, it can be a bigger issue than if you were always exposed to a little amount. And sure, maybe there's things out there that we don't quite know what's happening in each individual little cell and things, but generally most of the scientists are going on the model of the linear non-threshold model, where cancer increases, the y-axis, increased cancer, x-axis, dose, as you increase dose, you increase the cancer incidence. So Health Canada speaks to different risks associated with different levels. And I'll point out here that the 200 is the guideline, and for a non-smoker, they say that's a 2% risk. Well, if you were to look at different things that we have out there, like food additives, cosmetics, whatever, if somebody was to try to get a product out in the market and it had a 2% or a 1 in 50 risk, it wouldn't even get out of the starting gate. So this is definitely concerning when you start to look at some of these numbers here. There's a huge amount of buildings, many buildings that are way over 800, major. So we have to talk apples and oranges. I should say apples and apples and oranges when we're talking radiation. There's alpha, beta, gamma. Alpha is an alpha particle, and it's very easily stopped by even a sheet of paper, your skin, or lung tissue. Beta, another particle, but a little bit more penetrating capacity, and gamma can go right through the body. So the key issue with radon and alpha and radon decay products is that it gets in the lung, and the immediate tissue that it's next to will absorb the big hits. So what kind of hits are we talking about here? We have, here's radon, and it goes through, it has a 3.8 day half-life, and then roughly in about 50 minutes from here, and here to polonium-214, we're into this fast decay, 3.1 minutes, 27 minutes, 20 minutes, and 160 microseconds. These two here, the polonium-218 and the polonium-214, those are the ones that give the major punch, the major kick to the lungs and the cells. Those are the ones that are considered to be the damaging agents, the one that disrupt the DNA and can potentially cause cancer. So inhalation of airborne radon decay products, for the most part, accounts for the most part of the radiation dose, rather than the inhalation of radon itself. So I'm one of these, I believe in, with PowerPoint slides, less is more, but I put a lot of stuff in some of these slides coming up. I'm not going to read everything. People ask for the slides, and this way the information is in there. You can go through and read on more. What I'd like to do is move along and leave time for questions. So keep in mind, it's the radon decay products that are the issue, not as much the radon. We measure radon, and there's guidelines for radon because it's so hard to measure radon decay products. Radon is a good indicator of how many radon decay products there could be. I just want to touch on radon in water. It can be an issue, but again, the main concern is breathing the radon that has escaped from the water. Similar to how chlorine in water can produce trihallomethanes, and you're in a shower with hot water and you breathe in some THMs. Well, one of the ways to get rid of radon out of water is to aerate it. So what happens when we have a shower? It aerates. So the inhalation of the RDPs is the prime concern, which could occur in a shower if the radon escapes from the water and it goes through its 3.8-day half-life. But most of the radon that's escaping from the water is not going to immediately go through its 3.8-day half-life and form an RDP in the shower. However, if you're testing your house and you have high radon and you've done a bunch of work to try to lower it and you're still getting high radon, you might want to look at water as the source, especially if you have a well. Now, in the USA, they say there's 168 cancer deaths per year due to radon in water, which 89% of them are the lung and 11% are stomach. So use the 10% rule. For Canada, 10% population, you can roughly get in there, 8.9 and 1.1. Even I made a little note there off to the right, there's roughly 700 lung cancer deaths attributed to radon in outdoor air because everybody's exposed to it. These are pretty coarse estimates, but the scientists have come up with different numbers, and they don't just pull these out of the air. There's been a lot of numbers and epi work and dosimetry and everything been looked at. I wanted to put down some websites, links for folks to go to later. I want to just talk on our interior health sampling, just to again dispel any thoughts that, oh, I don't need to worry about radon. It's not around, but it is around. I work in the interior, and one of my jobs that I do is trying to promote people to test, trying to assist people with information on how to mitigate. And we took on a big daycare sampling project. And this is a school in the Kootenays. It's a mobile home trailer type. And yes, it's amazing how many mobiles have had high radon. They're skirted and it comes up through the building stack. I sent detectors out to 840 child care facilities, and we used 2,303 detectors to test some IH buildings. And here's what we got in the child care. 47% followed through with testing. It was a voluntary project at the time. And we're looking at 10.9%. We're above the guideline, and we had 1.3 above 1,000. For our IH buildings, we had 1823 detectors were actually submitted to the lab, 17.7% above the guideline, 1.5 sites. So it's roughly the same, getting in there. Just this week, I checked what our status is in our child care. We have a few less child care facilities than we had in 2014-15. 780 child care facilities, 563 have tested. 499 listed as acceptable, 64 unacceptable, 217 unknown. And so we're looking at 11.4% out of those tested that are testing above the guideline. How does this compare to a huge cross-Canada survey? Well, out of over 13,000 tests, Health Canada found that New Brunswick's has 24.8% showed that they were above 200, which is the Canadian guideline. Manitoba 23.7 and BC 7.9. However, I might add, if you go into this website at the bottom of the screen here and you look up your health service area, you will find that the Kootenay boundary area, for example, exceeds the two high provinces. It's 29.3. A study by BC Lung Radon Aware found that 59% of the homes in Castlegar tested above the guideline. So I just want to touch on where we sit with this, with some of the legislation. The Public Health Act, you're not going to find anything prescribed in regulation pursuant to the Public Health Act about radon. If the Public Health Act was to be used, it would have to be used under the broad context of the broad definition of health hazard, which is a condition, thing, or activity that endangers or is likely to endanger public health. So what I'm saying here is, in regard to us promoting people to test homes, some people think, oh, this is the health authority or the government sticking their nose in people's own private buildings. No, it isn't. We're trying to encourage you to test for your own good health and the health of people in your home and your family. And the Public Health Act, for most parts, legally has no business or jurisdiction in somebody's own home unless somebody would happen to be in their home doing something just beyond imagination that could impact, many, many people beyond the scope of their home. What we did do though, and we used the Community Care and Assisted Living Act to require in the child care operators to test for radon. We stepped forward and did that. From a workplace aspect, there's a BC Occupational Health and Safety Regulation. There's Division 3 that talks about natural background radiation. Basically doesn't apply. But again, I go back to the same thing. Although radon is natural, what isn't natural is how we build. Section 7.19 speaks to workers' exposure. It's not to exceed 20 millisieverts per year effective dose, and an exposure control plan should be in place if it exceeds 1 millisievert per year. So keep those two numbers in mind, 20 and 1. Key issue here is when you talk to occupational health and safety folks, enforcement officers, hygienists, the whole field, if you just bring up becquerels per meter cube, you'll get this kind of look like, okay, what's the dose? The occupational health and safety folks work on millisievert per year dosage, not on becquerel per meter cube radon and air. You're not going to find a becquerel per meter cubed listed in the BC OH&S reg, or, to my understanding, any occupational health and safety reg. I don't know if it exists. Now, the federal government did have a list for their workplaces. It was 800 a few years ago, and they were working, I think, on changing it to 200. So this is the issue. We got buildings that are high in radon, but what is the dose? Now, there's a way to convert this. But before I get into that, I'm going to just touch on the average effective dose in Canada is 1.8 millisieverts per year. That's what we're getting, and most of it, about half is from, half is from inhalation. Put this in context, a chest x-ray is about 0.1 millisieverts, a CT scan is 10. Now, depends, when you read these, you got to put into context. What are they CT scanning? How many passes? All this sort of thing. Just this morning I read that 2 or 3 CT scans can provide a 90 millisievert dose. Well, the math doesn't add up here, so obviously there's kind of a range depending on what is being scanned in the body. Cross Canada flight, any high flight, really high altitude, you're going to get a cosmic rays, the protons coming in, and this is a full body dose. It's not like an alpha hit in the lung. So if you exceed this 1 in your work performance, then you fall into what's classified as a nuclear worker category. So a nuclear worker effective dose is 50 with no more than 100 in 5 consecutive years. So general monitoring reflects that workers are getting about 5. The average risk of dying in cancer in Canada is 25%, 1 in 4, and getting cancer is nearly 50, 1 in 2. Pretty depressing. So scientific consensus considers that a 1,000 millisievert hit is going to give you another 4%. So a person working, by design, a person spending, there's all these safety margins put in here, working 50 years at 20 millisieverts, your nuclear worker life is going to give you an extra 1,000 or an extra 4%. and you're at 29 rather than 25. It's a violation of law for a radiation worker to exceed an annual dose, and I've been told that it's a huge issue if a nuclear worker gets a hit of 10 in their work, that management would be up for some major questioning on what in the heck was going on at the plant. So now we're getting into converting from becquerels into working levels and millisieverts, and in the flavor of time, I'm not going to go through each and every calculation here. In the next 4 or 5 slides, there's definitely, it's been checked over, I've been told it's right, and my calculations have worked right, so you can look through these and if you want further information. The point is, a working level is based on a mega electron volt, this is atomic now, lung exposure, and it's a measure of energy per volume of air, not a measure of where we come from was radon per meter cubed, or becquerels of radon. So what we're getting at here is we need to convert the working level to a working level month to get your millisievert per year dose. Now, you must use what's called an equilibrium factor, and that's very important. The scientists have come up with 0.4 as a factor that's generally used. And what that means is at 0.4, you have 40% of your radon decay products are floating around. In cleaner environments like mine shafts that are really heavily ventilated, you might be able to use a 0.2 factor. The higher the number, the more millisievert per year dose you're going to get. So we walk through this. You get your becquerels, or your becquerels, and you got to convert it into you got to use the picocuries to get into this, and then you get your working level, and then your equilibrium factor, and then your number of hours per month, which if somebody's working way more than a normal shift, you got to have more hours, and then you get into your time per year. Then you convert to millisievert per year exposure. Now, this is where the big changes come in. Your working level month per year times 10. It used to be 5. So that's the new ICRP 10 factor. So what I'm going to do is get into some examples and just try to make some sense of this here. Before I get into that, I'm just going to explain that, roll the clock back 10 years. There was a project done by Dr. Ray Copes and partners for WorkSafe on the level of radon and how much of an issue this is in BC workplaces. I remember speaking to Dr. Copes about 10, 12 years ago, and I said, hey, what could we do to get a big bang for a buck? And Ray said, radon. I thought, oh, interesting, and I didn't know very much about radon at all. And he did up this report, and under his report, he was classifying a health hazard as exceeding those numbers, the 20 and the 1 that I said earlier. So what did he find? And generally, he found that it's not a health hazard radon is not a health hazard in general BC workplaces. However, the BC interior is radon prone, has elevated levels. Some workplaces do present a radon-related health hazard, in other words, above those numbers. Recommends review OH&S policy around this issue of natural, which I described earlier. Recognizes that radon from natural sources should be included in the reg, because it's not. And adopt the Made in Canada work that's already been done on protecting workers from ionizing radiation. So in November 2009, under the Dr. Copes' report, a dose of 1 millisievert per year equates to radon concentration of 150 becquerels for 2,000 hours. Well, under the new doubling effect on this ICRP, I say, well, we can double this now. It's now 300 becquerels per meter cubed. So, and we can half the action level from 200 down to 100. Actually, I made a mistake there. That should be 2 millisieverts, equates to the 150. Yeah, I got to change that. Sorry, because your 150's double hit. It's 2 millisieverts. Makes more sense. New ICRP effective dose coefficients. Interesting, dose calculations use biokinetic and dosimetric models. Now using this with 2/3 of the time in exercise for the first 3. So working in a mine, you're obviously not stationary. Indoor places, you're moving around, tourist caves. So rather than the 10, they doubled it from 5 to 10. They have enough evidence in their calculations to carry this to 12, 20, 24, 14, and 13 for stationary in homes, for example. So approximate converted from millisieverts to buildings, and what the ICRP recommendations is they settled on a 10, okay? They doubled it from 5 to 10, this multiplication factor. And for indoor workplaces with substantial physical activity, such as gymnasiums or what have you, you can use 20. So that's a huge increase. I say you should look at the full dose, not just your workplace. So scientific evidence lends to using a 14 factor, but the body of contributing scientists accepted a doubling of the factor from 5 to 10. So certainly there's areas out there that are below the guideline, but this gives strength to even making sure that people who are below the guideline or think they're in a low area, it's not mapped as high, to get out, get a detector, and test their indoor environments. So remember these numbers, the 1 millisievert per year and the 20 as we go through this. I'm going to go through a few examples. That house that had 7,800 becquerels per meter cubed on the main floor, the lady in the house, her neighbor said she should test. She had 2 little children crawling around on the floor. Now I did some numbers here. A little unusual that someone would spend 24 hours a day, 365 days a year, but it is possible. But let's just look at this. If somebody did spend every day of the year in this house, we're coming up with 515 millisievert per year hit in that house. That's huge. Now imagine what the workers got in the basement. So we could see that even an 8-hour shift at this is going to give you a major hit. More realistically, these are some of the daycare. We had a daycare at 3,156. So if you go 7.5 hours a day, 5 days a week, you're into 36.12 millisieverts at the new factor. If you use what the science said they could use, 14, you're even higher. So another daycare was 1173, 7.5 hours a day, 5 days a week, we're at 13.42. At 300, there's a huge number of houses that are at 300, all kinds of them. You're getting 2.74 millisieverts per year at the 10 factor. ICRP views a 300 becquerel per meter cubed to correspond to roughly 4 millisieverts per year at work and 14 at home. That's perhaps a little bit on the safety side because that's assuming 7,000 hours a year or 19 hours a day in your home. But still, dose is a dose. It doesn't matter if you get it at home or at work. So let's look at 365 days at 24 hours a day, and that's the number of hours you're going to get in a year. So break that down to 300 becquerels for 8 hours a day, 5 days a week, 2,000 hours, and there's a lot of workplaces, a lot of homes are going to be at 300. We're at 3.88. And at home, at your 300, you're 11. So add the 11 and the 3, that's your hit. That's just from radon, by the way, or radon decay products, not what you're getting from all the other exposures you're going to get in CT scans and airplane flights and so on. Using the previous scenarios, a lot of houses, a lot of buildings are at 1,500. your work is going to be 19 and your home 56, and add the two together. That's you're way above 1, and you're way above 20. Yet radon is not something that's being on the agenda of being tested for in most buildings. I'm going to go through some real quick mitigation slides because most people watching radon presentations, especially if they're newly introduced to it, always wonder, well, how do we get rid of it? Arthur Scott, the late Arthur Scott, invented what's called Sub-Slab Depressurization. He's a Canadian. It's used globally, and essentially what it is you create a path of least resistance from below the slab into a pipe and out, rather than it coming through the building. So you counter the stack effect. If you put a radon detector below most slabs, you'll commonly find 30,000 becquerels per meter cubed. This is a house built in the 1898 era, south of Kelowna. It had over 2,000, and it has several different building kind of renos that have been done. There's dirt crawl space, gravel, a little bit of concrete, and it was, very much concerning to them and how we're going to fix this. I gave them some pointers on the mitigation course that I took several years ago in the States. They punched a hole in the concrete, which is well below this level here, hollowed out a sump, put a pipe in it, grouted around it, and did what Arthur Scott invented, which is sub-slab depressurization. There's the little instrument measuring their vacuum, and it worked. It worked really well. This is a rough-in works that the BC code now requires rough-in on the ground before the concrete slab is poured, and the BC code is quite progressive on that. The national code, they're working on some upgrades to it, and the national code is used by provinces as a guide for the provinces to adopt either in full or part. So what would happen is, before this building is the concrete, they'll put gravel over this pipe, and then poly, and then they'll pour the concrete. In a lot of cases, they'll put insulation down too. And that, if the building tests high afterwards, it's easier to fix because you've got your rough-in works there. You disconnect the pipe and hook up a fan up on top, and out goes the radon. So I'm closing this off here. Basically, figure out your millisievert per year dose from radon and all different sources. Where I think this needs to go is we need to get radon on the agenda, on the workplace environment agenda. It's definitely a radiation exposure. It's far above a lot of other occupational exposures, and it's could be definitely an issue. I've put some radon websites here that can be very helpful. I recall when we did the environmental tobacco smoke, getting it out of bars and restaurants, 15 years ago now, I guess. I was on a Ministry of Health Authority, WorkSafe, environmental tobacco smoke implementation working group, and we were successful. The three parties got together, the legislation was changed, and we made it work. And it was a maybe there's some opportunity there for agencies to work together again on this. Thanks a lot, and that's all I have, and I think I left some time for questions. Yep, and that, by the way, is a mitigation fan on the outside of a school in the East Kootenays, a two classroom school. Great, thank you.
Thank you very much, Clyde. So I do have a couple questions from our remote audience. However, I'm going to give Karen.
Thank you, that was a very nice overview. So being aware, as you said, public health really can't impact other than through education, people's individual residencies and things like that. How do you deal with either the educational component or the reality that somebody does test their home and they would have to disclose that when they go to sell their home?
Well, that question comes up a lot, and as we move forward, in the United States, for example, radon is quite well known down there because in a lot of states, a radon test is required at the time of sale. As more and more people test and more knowledge gets out there, people are going to start asking, well, I want to know what the radon level is here. And for instance, in our daycare letters, when we supplied the information to daycares, the letters said, this is your result. We encourage that this publicly available information be disclosed to your clients for good transparency. So we went through the urea formaldehyde, and it was on just about every real estate deal 20 years ago. The states are way ahead of this on the radon thing. And eventually, what I would look at it is as a selling feature. What I know about radon, if you test it and it's below the guideline, and you disclose that, that's good. If you fixed it, you've got a mitigation system in. There was a doctor down Peachland Way. He was way below the guideline, but he says, I don't want my kids breathing this. And he put a mitigation system in and got it even lower. So it's all timing, and it'll come. Yeah.
Thank you very much. I was curious in hearing a bit more about the daycare, because I think it's kind of a perfect storm of babies, workers, and personal private homes often, I think, these daycares. So I was curious to hear more after this testing, so they got a letter, and then I guess for them to whether that's an opportunity, I guess, to move something forward, a particular combination of babies and workers.
Oh, totally. The detectors we sent out, we provided them free, and we encouraged operators to take advantage of this free detector. And we wrestled with, do we use the act and require it, or do we kind of make this voluntary? They already had received a letter signed by the senior medical health officer informing of radon and encouraging them to test. That was in 2010. We secured that memorandum of agreement with Health Canada. We had some funding for some detectors. We decided to kind of progress it forward, and we didn't require it. Living with what I've learned from this exercise, if I was to do this again, or if I was to recommend any area, a health department in Canada that was thinking of embarking on this, go right to requiring it. They'll actually, the daycare operators will appreciate it, because what we've done now is the 54% that didn't test, well, we're requiring them to test. Well, where's my free detector? And, well, no, they're not free anymore. Just last week, I received a detector that the licensing officers have been out saying, hey, what's your radon result? Oh, and somebody actually pulled a radon detector that had been sitting deployed since 2014 and mailed it in to me to test. Well, it's long expired, yeah.
So we do have a few questions here, and a lot of congrats from the Radiological audience. The first question I had was on the practical side. So given your experience, could you recommend a reliable but not costly radon monitor for residents who are interested in testing their homes? And
A reliable radon?
But not costly. That's the question.
Okay, I recommend you Google radonaware.ca. That's through BC Lung, and they have an AlphaTrack radon detector for $29.99 that includes laboratory analysis. Now, be careful about some of the hardware store radon detectors. They're $15, but when you get home and you open them up, you'll find you need to send a $40 check to the lab. And I recently had somebody by mistake mail me a detector from a hardware store. It was 2 little vials, and I read the instructions, and it said to open the vials and leave it in your house open for 4 days. Well, houses have, even the tightest houses will have 1 air change per 5 hours. Basically, leaving those 2 little vials open for 4 days, you're sampling the last 15 minutes of air, basically. No, get an AlphaTrack detector. It's a thin sheet of film in there that is pitted by alpha energy, the alpha particle, and that's the way to go. So if you're listening from another province, Google your local lung association I would say the lung association. Try them out, or the health authority, or some agency, and you should be able to find one.
Great. That was really helpful. So there was another question about the lab analysis. So let's say you have those dosimeters in your house, then you send them. How do you test? Do you send it to the lab for analysis, and then you get?
Yes.
Is this something that's how do you understand your
Yeah, when radon decays, it produces an alpha particle. So this little AlphaTrack detector has a sheet of film in it that gets pitted by the decay, the rapidly fired high energy alpha, and then you leave that in one spot in the house. You don't move it all over the place. It's in the lowest lived-in area where it could be occupied for greater than 4 hours, and for at least 91 days. You want a long-term test, at least 91 days. The levels of radon can change according to high-low air pressures from day to day. The problem with doing a quick 2-day test is you could get a false negative. In other words, you think everything's fine and it's not. At least a 91-day test during the cold months of the year. After 91 days, you package it up and it goes to the lab as per the instructions. Somebody in the lab cracks a thing open, puts it under a magnifying glass or microscope of sort, counts the pits per time exposed, and that's how they get the radon.
So there's a question about the recognition of knowing if you have higher or lower level of radon. So the question goes as, are there geological features observed from the ground or from space that would indicate the radon concentrations?
Well, there's potential indicators, and as I mentioned, a company in British Columbia, Radon Environmental, made a map up like that, and it can be very helpful. But again, remember what soil is. Soil is often ground up rock, and just because there might be higher uranium in one area doesn't mean it hasn't been carried to another. For example, one of the highest radon levels in the United States is Iowa, and Iowa's a clay farming belt. Manitoba's really high, lots of clay. So the point is maps can be useful, but don't make a decision to not test based on a map. And whatever you do, don't make a decision to not test just because your neighbor tested and they were low, because radon can be high on one side in one house and low in the next.
Another question from our listeners. So someone is wondering how much it costs to install the depressurization system that you have
I fixed my house for around $300, and that was myself and a buddy that's extremely handy, me doing all the grunt work in the crawl space and him doing the things that were technical, and that was me doing it. Now, if you pick up the phone and call a radon professional, if you Google C-NRPP. There's a list of radon professionals. They have to make a living too, so that you're going to have to pay for their services. And it can go anywhere, I've heard, $1,200, $1,500 up to $3,000.
And I have a question. Just checking this, we have another minute. So, could you tell us a little bit more about the sampling that you've done in the daycare? So, did you do it during a specific season, or how long of time? And was it like repeated? How did you go about your sampling?
Well, we sent the detectors out in early January and wanted them to be deployed for at least 91 days. But if I could give anybody any advice that's thinking of embarking on this, in the radon world, you got to be 6 months ahead of time. If you're thinking of sampling and sending out detectors in October, have your meetings in May and June and get ready for it. I could give you a huge number of examples of different projects, well-meaning, well-planned, except time slips away. And all of a sudden, you're scrambling in, January or February when you should have been on this in November or late October.
We have many other questions here. Very good. So please join me in thanking Greg for this very, very good presentation that we had today. Thank you.
Thanks.